How do we address fear? In a practical way, how do we address that? Yeah, look, because that's going to be present, isn't it?
Absolutely. I mean, I think that's probably the core driver of what causes distress from medical diagnosis, being afraid.
Yeah.
So say people have had someone's had a number of what we would say stereotyped episodic events where they might get a weird feeling, like they're sick, lose awareness for a while and come back to consistent with a focal seizure. So you've had a few of these, your EEG shows this, you've got focal epilepsy. I think probably the first thing that happens is they're absolutely frightened.
Yeah.
What does this mean?
Yeah, that's right.
Is this going to keep happening?
Yeah. What's
going to happen to me? You know, I'm going to take tablets. I don't want to take tablets. They're scary too. What if I get side effect from them? I think fear is probably what it is to start with for any of us. Certainly, you know, a cancer diagnosis, you're just terrified you're going to die.
Yeah.
So I guess dealing with that is again using those same principles of saying to people, you know, you may not use the term fear, but you may say this is, you know, this is a stressful event.
Yes.
And we all have, like from a talk I gave once, I read some literature that said, you know, we've all got a bucket of resources to deal with stress. Yeah. Stress can be sad stress or bad stress, losing a loved one, being diagnosed with a medical condition. It can be happy stress, having your first baby, planning a wedding. And you've got a bucket of resources to deal with that. Once those resources are used up, you become distressed. And that's probably where most people are sitting at that point in time.
Yeah.
And so I think making it very clear that that's a normal part of the reactive process right from the start, so that then they don't fall into that impaired or dysfunctional sort of grief reaction, because medical stuff's the same. People are in denial. They're angry. Why me? This isn't fair. You know, I've done everything right. Like me, I read all the books about the baby. It's not going well. You know, I've eaten well. I've jogged. I've, you know, taken my vitamin supplements, and I'm still getting this thing. Yeah. Then sad, because no, you don't want to be sick. Yeah. And then acceptance. Whereas I think lack of acknowledgement early on is probably where then people get stuck in that abyss of the combination of all those things that just repeats itself. Yeah. And then impairs often their quality of life more than the disease itself. Yeah. So we see, you know, say, talking about how we can fix things, 70% of people who get diagnosed with epilepsy we can control with anti-epileptic medications. And the vast majority of the time they'll tolerate them fine. Once you get over the psychological dislike of having to take tablets, which is a huge thing, people are like, all right, that's fine, got over it, take my tablets, I'm great. But there's a percentage of those people where their lives are still impacted, even though their seizures might be controlled, because of that undealt with anxiety or the impact the stigma of the disease had on them, their development, their employment, their social and relationship interactions. And so it really does have a big impact on quality of life. Not in everyone, but as we were saying, nothing's specific to everyone. Yeah. Because it's all very individual.
But fear is across the board.
Correct.
Isn't it?
Yeah, well, that's what we're all frightened of. Yeah. Losing a part of us. We're frightened of not being normal. We're frightened of it impacting our relationship or our job. You know, many of my patients can't drive for a period of time until they're seizure free for the prescribed safe period. And that may seem such a simple thing, but I kind of say, and it's really true, most of my patients, you know, they don't really love being diagnosed with epilepsy, but they don't mind that nearly as much as when I tell them they can't drive.
Can't drive. Takes your freedom away.
It's a disaster. I mean, it has to happen, because otherwise something catastrophic could happen to them or other people. But, it's those sorts of impacts that, you know, and that you can't drive would immediately make you feel frightened in a way of what you can't do anymore. Yeah, yeah. So you're right. It's fear in different forms. It's like us talking about using the forgiveness analogy for, you know, reconciling a medical illness or dealing with a trauma. It's just a different name for the same concept. Yeah, yeah.
And it's universal.
Correct.
Yeah. It's one of those things that, you know, we all will have it at some point. Yeah, it's true, isn't it?